Hello, my name is Dr. Saib Gallagher. I'm a plastic and reconstructive surgeon. I do a lot of gender affirmation surgery and I'm located in Miami, Florida. And in this video, I'm going to talk about torso masculinization, what it is, who opts for it, what's involved, and what this thing is, and why it's the worst part of torso masculinization. So, to start out with, I'd say this procedure is probably the fastest growing procedure I'm seeing amongst my transgender patients. And the reason is a lot of folks explain to me that, for example, trans, masculine or non-binary folks, that it's the curves that kind of bother them a lot, almost as much as the chest in some cases. And oftentimes what my patients express they don't like is the kind of love handle area, or how we have the appearance in the torso that they have a waist that goes in and then it curves out again in that kind of hourglass shape. And this does bother a lot of patients. And the good news is, in a lot of folks, there's a fairly easy way to eliminate those curves. And what we're trying to go after is a hip to waist ratio of about 1. So a much more straight up and down look, which signals a masculine torso. In most patients, we end up doing liposuction. Liposuction is a great technique because it helps us spot reduce. It's one of the only ways, really. There's some other things, Sculpted, Kybella, other ways that aren't nearly as effective, but liposuction allows us to pinpoint an area and say, we really don't like that, we're just going after that. If we lose weight, a lot of patients will keep their shape, so they'll keep that hourglass shape and everything kind of shrinks at the same time, whereas liposuction allows us to go in and target certain parts. It does go very well with top surgery, and typically that's when we're doing it, I would say about 30% of my patients who have top surgery now are opting to do torso masculinization at the same time, and that way they just recover at the same time. It's usually not any more time off work or the gym. And so how we're usually doing it is 2 little incisions hidden in the belt line, which are going to disappear. And when you wake up after torso masculinization, let's just say we're only doing liposuction, because we can do other things like tummy tucks depending on the patient's needs, but most of the time we're just doing liposuction. So when you wake up afterwards, we have this bad boy. And so this is your binder, and basically I've been through lots of different garments, but what we want is something that's going to compress the areas. And so basically you wake up, we have this, we got some dressings and foam underneath, but this is going to keep our swelling down, and it's probably, there's some evidence as well that it helps our skin shrink down to our new anatomy. The really nice thing is the skin out at the sides, at the flanks, it tends to be pretty forgiving and tends to shrink quite well. So folks don't in general end up with loose skin after this procedure. The thinner skin in the center of the belly, that's a little bit less forgiving, but oftentimes at the same time as going after the flanks, we're toning up the belly at the same time as well. So the most annoying thing about this procedure, I'd say there's probably 2 annoying things. So first of all, if you're doing this with top surgery, you're going to get the instant gratification of seeing the chest. Not going to be perfect, obviously, but there's no mistake that we did top surgery. Whereas with this surgery, it usually takes up to 6 months to see your final results. Things can be lumpy and bumpy and bruised in the meantime. But what bothers patients the most, and it's not a huge deal, is wearing this thing, this binder. This goes underneath your clothes, and I do make my patients wear it night and day for 6 weeks after surgery. And usually after that, most patients will go down to wearing it just at night or get rid of it at that point. But it tends, you get used to it very quickly. You just put it in the washing machine between uses, and breaks are of course allowed here and there. But that is torso masculinization and an overview of what's involved. I hope you find this useful, and shameless plug, in this book, it's almost 2 years old now, affirmed, it's available on Amazon, and it's basically this channel in book form. 9 other experts helped me write that book, and hopefully you'll find it very interesting about all things gender affirmation. It's available on Amazon, and if you like the contents of this channel, please like and subscribe, and thank you so much as always for watching. Take care.